abuse that privilege, give chance to others. Supplementary questions will be allowed. And let's focus on the topic of the day. We are talking about Medicine Control Agency and the tourism. So if there's anything along the line, then the ministerial discretion will elaborate on that one. Without wasting time, Honorable Minister, the floor is yours.
Gentlemen of the press, we welcome you once again to our monthly press conference. I'd like to first of all welcome the agencies that we invited today, and we thank them profusely for accepting our invitation. The Medicines Control Agency, under the leadership of Mr. Marian and his team, are here today to update Gambians about their work. We all realize how our society becomes complex. There's a need. Now, the work of the agency is expanded, and recently we've seen them taking very proactive measures. It is why that we bring them to face the Gambian people, to discuss with them what they are doing and the challenges they are facing, and what are their expectations from the public, or what are the public's expectations from them. We all know that the Gambia has 2 seasons. Whenever we say season, we start now, we know it means the tourism season is about to start. I think the first flight is coming this week. It is also therefore important that we invite the Gambia Tourism Board to come and update Gambians about their preparations for this season. We are looking forward to a very, very successful season, so they are here to update us as well. I also extend greetings to the PS, Ministry of Information. She's here today, the Director of the Department of Information Services, and also special thanks to our media partners who are here today covering this event live. And also obviously to the Chair representing the spokesperson's office. As our mandate is to give information to the public, but also take information from the public to the government. And I think the media acts as a conduit to this. That is why we see the media as critical partners of the ministry. Now, one of the things that we try to do is what we call proactive disclosure of information. We don't want, even though there is an ATI Act, which gives the privilege and the opportunity to citizens to request for information if they so wish from the public, as long as that information is not classified. We are duty bound by law to provide that information. But however, we also have a mandate to ensure that we give the public timely, authentic, relevant information. So therefore, this is why we organize this press conference, but also the Mansakunda, where the public officials have an opportunity to interface with the public so that the public can ask critical questions about how the country is governed. So therefore, this is one of the reasons why we organize this press conference as our drive for proactive disclosure. Now, going back to the updates from government, the first update is from the Ministry of Foreign Affairs, which has been closely monitoring the situation in the Middle East, particularly in Lebanon. And therefore, because of the critical nature of the situation in Lebanon, the Ministry of Foreign Affairs has initiated a process to immediately evacuate all Gambians that are living in Lebanon. As such, they've provided contact details for Gambians who are living in Lebanon to call those numbers and get registered so that they can put plans in place to evacuate them from Lebanon, because we all know that the situation is escalating in that particular part of the world. So Gambians living in Lebanon are all to call those numbers. If you don't have those numbers, I don't have them here, but if you go to the Ministry of Information's Facebook page or the Ministry of Foreign Affairs, you'll get those numbers to call so that we can get registered, because plans are afoot to evacuate Gambians who are living in Lebanon as the situation escalates there. The second update is from the Ministry of Local Government and Lands. The release says that the ministry has suspended all development activities within the ecologically critical wetlands area in Cape Point. That despite prior warnings issued in May 2024, unauthorized development continued to threaten the area's sustainability. Now, a task force, according to the ministry, has been established to investigate these violations and ensure compliance with environmental regulations. The ministry warns that failure to cease unauthorized activities will result in severe penalties, including legal action and removing of illegal constructions. That release is from the Ministry of Lands. The third update is from the Ministry of Youth and Sports. And it says that the ministry has approved $12 million as a contribution to the Gambia Football Federation for the national team's upcoming AFCON 2025 qualification matches against Madagascar. The funding will cover flight tickets, accommodation, and match bonuses for games scheduled for 11th and 14th of October 2024, and it will take place in Morocco. The government extends best wishes to the Scorpions in these matches, and the Ministry of Information also extends best wishes to the Scorpions, and we hope that we will win these two games. The fourth press release is from the Office of the President. The President, His Excellency Adama Barrow, bade farewell to 80 economic officers at a ceremony held at the State House. The President expressed his gratitude to ECOWAS and Senegal for their support in safeguarding the Gambia's democracy and thanked the officers for their service. Certificates of appreciation were also presented to mark the end of their mission in the Gambia. The fifth press release is from MOPSI, the Ministry of Basic and Secondary Education. The ministry will distribute textbooks to senior secondary students across the country. The textbooks authored by Gambian writers reflect the local context, and the aim is to enhance the quality of education in this country. The initiative is part of the government's commitment to improve education service delivery. The good thing is that these textbooks are home content. For the first time in our history, we have textbooks that are written by Gambians, reflecting our history, our geography, our societal norms, our tradition, and our culture. And the final update is from the from the First Lady's Office, scholarship for top female students, that the Office of the First Lady, Her Excellency Madam Fatoumata Barrow, has awarded scholarships to the top 10 female students of the 2024 WAS. The ceremony held at the State House honored the academic achievements of these outstanding young female students, with the aim of encouraging excellence among young girls in the Gambia. Now, these are the updates from the Ministry of Information, from the Government of the Republic of the Gambia. We look forward to presentations from the Medicine Control Agency, after which we'll open the floor for Q&A. Then we'll have the Gambia Tourism Board to also do their presentation briefly and Q&A sessions. We're looking forward to very constructive dialogue with the media today, and we hope that tomorrow we will again control the narrative and ensure that the public is aware of what both agencies are doing. Thank you.
A lot of government activities for the past 30 days. I would like to proceed to the presentation of the Medicine Control Agency, which will be led by the Executive Director, Dr. Issa Marina. Before he comes to the floor, I would like to acknowledge the presence of his capable team. We have Madam Fatou Ndiaye, Director of Clinical Trials and Pharmacovigilance. I hope I got it right. And Marema Sima, Director of Evaluation and Registration. Madam Tida Jallo, Director of Operations. And Mr. Tida, sorry. Okay, Tijan Jallo, Director of Operations. And Mr. Balde. Thank you all, Executive Director, please.
Pleased to thank the Minister of Information for giving MCA this opportunity to be present here today to share some information with the public regarding our mandate, our functions, and our activities. So I would first of all wish to start with a short overview of MCA. Medicines Control Agency of the Gambia was established by an Act of Parliament in 2015, May 2015. The Act of Parliament that established the agency is called the Medicines and Related Products Act 2014. So this act has mandated the agency to control and regulate the manufacture, the export, import, distribution, use and advertisement of medicines and related products. So in terms of medicines, I know there are so many controversies because recently we even have a case in court where we found some products illegally imported and selling them. She contested those are not medicines. So we want to explain what medicines cover to the general public. For medicines, we have different types of medicines. We have the conventional, also called orthodox medicines or allopathic medicine. So you can call it conventional, orthodox, or allopathic medicines. These are the paracetamols, amoxicillins, etc., etc. We also have what we call herbal medicines. So the herbal medicines that we regulate are finished herbal products. We don't regulate the raw ones like the leaves, the stems, barks. We don't regulate those ones. It's the finished herbal products. Also, another category of medicines are the nutritional supplements or the dietary supplements. So these are also medicines regulated by MCA. We have the veterinary medicines that are also regulated by MCA. And the last but not the least is the homeopathic medicines. So these are the range of medicines that are regulated by MCA as supported by our Act. So for the related products, people also have to know these related products. They include mainly medical devices. When you say medical devices, it's a very big family. We have the equipment, any equipment that is used in the provision of medical services or health delivery is considered a medical device under our law. Also, for the medical devices, you have the diagnostic agents. So all diagnostic agents of all types also fall under our mandate. We also have other forms of medical devices, such as toothbrushes. It'd be interesting to know, but MCA regulates toothbrushes. In fact, we have registered some toothbrushes from GSK, Sensodyne toothbrushes, and others. So the other related products are the cosmetics. Very big class. We have lotions, we have creams, we have ointments, all different dosage forms of the cosmetics. We have soap, also is part of cosmetics. Not solo, I think we made a press release on Dove cream soap that was found to contaminate some harmful chemical agents. Also under the cosmetics, we have the mouthwashes. Mouthwashes are also cosmetics. Toothpaste, these are all supposed to be regulated by MCA. And we are trying to strengthen our capacity bit by bit. Surely within a short period of time, we should be able to fully enforce the regulation of all these products as we are going. So those are the range of products that are regulated by MCA. One other additional one is the household chemicals. We also have the household chemicals. So this household chemical, there is a bit of overlap with the National Environment Agency, but we are trying to concentrate a bit more on things that have some anti-infective properties like Dettol. You have Dettol and the other detergents that are used at the household level. So chlorine tablets, chlorine solutions. So these are some of the household chemicals. So for others, insecticides and other things, we try to leave those things to the National Environment Agency. And for MCA, the regulatory functions we have, there are many. But I just mentioned a few very key important regulatory functions at the moment that we undertake. One is licensing, and the type of license we give out are importation license to people who want to import medicines or the related products into this country. So we also have license for manufacturers. So anybody who wants to manufacture any of these related products in the Gambia is supposed to have a license from the Medicines Control Agency. We also license warehouses or storage facilities, because we want to make sure where these products are stored, they are at the right temperatures. Currently, I could say there are challenges in terms of most of the people who are storing these products to store them under the right temperatures and the right humidity. We know the country is quite hot, especially at this time of the year. Also, the place is very humid. You see humidity of above 70% all the time, temperatures high. And for medicines, they're supposed to be stored on the temperature of 25 degrees Celsius and humidity of not more than 40%. And so these are the issues. If you don't keep products under these specified temperatures and humidity, you expect the products to degrade or to go bad at certain point in time, even though the products are not expired and not so long. We sent out a press release of 2 products, a Butamol solution and one anti-malarial tablet called Plasmodial. These 2 products, when they were coming to the country, they were good products. They were imported in 2022. We are using them. But along the line, they start going bad. They start changing color, especially the solution. The first report our inspectors speak was around Basse. So when we got that signal from Basse, then all our inspectors around the country were informed to check all the other drugstores, and CRR2, they were able to pick some. So we have seen the same batch in the combos here. Some of the bottles have not gone bad, but for medicines, the moment 1 or 2 goes bad, you try to contain the whole batch, quarantine the whole batch, and stop people from using them. So the other critical function of MCA are the inspections. So we try to have inspectorates across the country, and this year we try to appoint also inspectors for the airport seaport. We are not covering the airport seaport, but the seaport office we opened there definitely is very critical at the airport, because we are intercepting a lot of things that we are coming into the country without our notice. So we are able to appoint some people. Thanks to the government, they were able to support us to recruit more people in 2024. And for the first time, we posted people across the country, every region. URR South, URR North, we have inspectors, CRR North, South, so across the entire regions. And also we are able to post people at the airport, seaport as permanent postings at those places. So they are carrying out inspections of all the products in those regions, in the licensed premises, at illegal places. We have seen not so long we've been able to arrest some illegal medicine dealers, and even 2 of them just recently got convicted in a court at Carnegie Magistrate Court, where they were convicted 1 year mandatory jail term, and also to pay $250,000 in addition. So in default, to go for 2 more years imprisonment. So this was a very powerful message to the public. People should stop involving illegal medicine businesses because this could be very dangerous for the safety of the population. Because most of the places they conduct these businesses, they don't observe the temperatures or the humidity. They put them anywhere they keep them. So our inspectors are doing a tremendous job at the moment around the whole country. So we also try to do port of entry inspection, because we have inspectors at all border points. At the moment, by law, only airport, seaport, and the 4 border posts are allowed for people to bring in any product that is regulated by MCA. You have Amdalai Port, it's a legal, Amdalai border, it's a legal border. Ker Ayub in Farafenni is a legal one. You have Sabi and Giboro. Any other border or port of entry, you bring in products, is illegal. Your products could be seized and could be confiscated. You could also be prosecuted for that because it's seen to be illegal importation. Even if you have a license to import, but the moment you bring products through illegal route, it's illegal. So you're supposed to only bring in products through approved route. So these are important things. We just briefly want to mention, we also have post-market surveillance activities. Post-marketing surveillance is all about monitoring the quality of the products whilst they are put on the market. As we know, they could be very good quality, but with time, due to storage conditions and other things, they could go bad. We also have pharmacovigilance, a big terminology, but it simply means safety monitoring. So we also monitor safety of products while they are on the market. So that's why healthcare workers, public, the patients, anybody, you could report to MCA if you take any medication, you happen to have any side effect or adverse drug reaction, you should report. You are encouraged to report to MCA. We have a toll-free number that you can use, or you can use MCA info email on our website to send any message. Our toll-free is very active. You can call it. So last but not the least, we have clinical trials. We will not go that much detail into that, but we have clinical trial oversight where we do approval for all clinical trials, and also we monitor all clinical trials in this country. So we have the power also to suspend, to terminate, or cancel any clinical trials, or we can reject the findings of that particular study if we find out that the studies, there are some lapses here and there. So the last but not the least is the quality control testing. It's one of the functions of MCA, but as we know, the government is doing its best at the Bruce B. Tone table to establish a national lab. This lab, by law, is supposed to be an independent lab, independent of MCA. The act that establishes MCA is supposed to also establish this lab. So MCA would serve as a client to that lab. So that is based on the law. But currently, what we do, all products that are being imported into the country, we have contracted accredited labs in most of these countries where pre-shipment testing is done. They collect samples on behalf of MCA, these labs, then test the products. Before the products get to the Gambia, we get the test results so that the products, when they come, they will not be quarantined for long to be shipped again for testing that the private sector has been crying about. So what we've done in China, we've got accredited lab there, independent accredited lab with their staff that goes, anybody who wants to import or export anything to the Gambia, you must contact them, register with them, and they will collect samples before they give you a green light to ship your products to the Gambia. If you don't pass through them, you import your products to the Gambia. When they come, we have to put them under quarantine. We give you administrative fine and send those products for testing. If it takes 3 months, 4 months, that one is not the fault of MCA, so you have to wait for the results to come. So I think, in short, that's what I want to say for sake of time. So I'm not sure if we still have some time in case any of my directors want to add something.
Okay.
Inspection, enforcement, and to add to that, anti-substandard and falsified medicines, focal point pattern for the country. So the directorate, whatever we are doing, we are not working based on our discretion. As he clearly mentioned, MCA was established by Act of Parliament on the 26th of December 2014 by the Medicines and Related Product Act. We also have the Medicines and Related Product Regulation 2020. So whatever we are doing, in those legislations, we need to ensure that it is in line with both regional and international standards. No one is working based on their discretion. And of course, the regulatory body, its key mandate is to ascertain every medical product. Medical product is a broad word which includes both medical devices, herbal medicines, orthodox medicine that you already explained, and also related products which include the cosmetics, to ensure that if they are coming into the country legally, it is of high quality, safe, and also efficacious. Of course, we know like our borders are porous. That's why we deem it is a necessity for us to deploy full-time regional inspectors across the length and breadth of the country, so that we will polish up our mandate to ensure that we will do the work effectively and efficiently. As we can all attest, not everyone will take certain kinds of hard drug, like kush or weed or cocaine. But for medicines, as far as you are alive, the moment you are sick, you must take it. But what we are advocating in the country is, we know MCA being the experts and the regulatory body trying to control the quality and safety of medicines. If we want to go fast, we'll walk alone. But if we really want to achieve the mission and the vision of the institution, which is geared towards safeguarding the general public, we have to collaborate. As we know, medicine will not bring themselves. People must bring them. So we are collaborating with also immigration officers. We know goods, whenever they get to any border, we have GRA officers there. So we are collaborating with them. When it comes to enforcement, we are collaborating with police. The list continues. So I will stop here. Maybe when it comes to the question and answers, we allude more on the technical part. Thank you.
I'll talk about the pharmacovigilance activities at the Medicines Control Agency. Again, we have a legal provision. It mandates MCA to establish a functional pharmacovigilance system. We have the National Pharmacovigilance Unit, which is based at the Medicines Control Agency, and it's the core of the pharmacovigilance system, which is responsible for monitoring safety of medicines and safety reports. We also receive and process all adverse drug reaction reports and work closely with the Medicine Safety Expert Committee. This is a committee we successfully established for the first time in June 2024, a multidisciplinary committee that reviews and evaluates all the safety reports and provide technical expertise and evaluate safety reports and makes recommendations to Medicines Control Agency in the area of clinical trials and pharmacovigilance. The committee also performs causality assessment. Each National Pharmacovigilance Center is required to set up a functional and efficient system to collect reports and conduct causality assessment. In this regard, the Medicines Control Agency developed and maintained a national database where all the safety reports received from healthcare professionals are uploaded into the database by the National Focal Person at MCDA.
Thank you very much, Derek. Apologies.
Of healthcare professionals, we have successfully trained 60 healthcare professionals from all the 7 zones in this country, including hospitals and private clinics on pharmacovigilance, just to improve on the patient reporting. Thank you very much.
Thank you.
These are selective, you guys are being selective in seizing other people's products and leaving others who are not registered. What is your take on that? My other question is, you have mentioned of your critical training oversight and quality among others. How effective is this? Because most people don't know about this, and this is new to some of us here. And also, you made mention of issuing license. So how do you issue this license? And Are there limitations in the production of these products that are brought in the country? Thank you.
An agency, we try to operate on a level playing field. And one thing we also have to know, MCA does not have the capacity at the moment to effectively cover everywhere at the same time. So we have to go to different places at different times. So today may be someone, and tomorrow may be another person. But what we are saying, like in the Gambia, most of the time people want their own personal experience. They won't try to do the right thing because MCA has caught one or two. They will be there operating illegally till MCA gets to them. They say, oh, we are not aware, we don't know. But since Aki, MCA, I think, has come to limelight. Everyone knows about MCA. So definitely, if anyone is interested in regularizing your businesses, you should be able to go out and find out what laws are in place for this business I want to venture in. So, but we cannot see everybody at the same time, but for sure, if you are not caught today, you may be caught tomorrow. So the other question was issuing of licenses. The way we issue licenses, as I said, there are different licenses with different requirements. The guidelines are on our website on every type of license that we issue. So please, if you want to get the details, they are on our website.
Issue of license, are there limitations on the products that are brought?
Yeah, that's the third question. Limitation on the products. Like MCA, the moment your product meets the legal requirements to be imported, it's left to you, the business person. The quantity you want to bring is not dictated by MCA. The price on the market is not dictated by MCA. So that one, MCA don't have any control over that. As long as your product we are satisfied has met the requirements for import, we don't have any restrictions on the quantity. The only one that there are restrictions on, are the controlled medicines. That needs to be clear because these are potential drugs of abuse. Those are the only ones we control the quantities. And why? Because Gambia as a country itself, there is a limit. We have a quota that we can import in a year into this country by International Narcotic Control Board. So that one we have to put control over it. Yeah.
Has already been
As I said, those functions are ongoing functions. It's not annual or it's not time-based. They are ongoing functions, like registration of products is ongoing. Anytime there is application, we have to act on it. Licensing, anytime there is application, we have to act on it. Inspections is an ongoing, it's a everyday activity. Let me tell you, our inspectors don't have time to work. For 8 to 4, that is every day, but after work, they have evening inspections. We have unannounced evening inspections and night inspections and weekends. So these activities are ongoing. These functions cannot be annual or be periodic. Though our reporting, in terms of reporting to government, is Minister of Health. Our board reports to Minister of Health, and I also report to the Honorable Minister of Health. Medicine. Traditional medicine is a practice. So herbal medicines, those are products. And the herbal medicines that we regulate, these are finished herbal products. We don't regulate herbs themselves. So herbs are the raw ones. These are the leaves, bark of the tree, roots of the tree, flowers. We don't regulate those ones. But if you process any part of a plant into a medicinal product, you have added other substances to it, you've got your own formulation, you have packaged it, you have labeled it, you have attached claims to those products. They could cure this or that. So you need to authenticate your claims through various means as required by the law. That's when the registration of those products come in. But the leaves at the Serekunda market for sale or the herbs, we don't regulate those ones. Okay. Under the practice, there is a unit on the Ministry of Health for traditional medicines practice that controls the practice. And you go to the air, you realize that MCA some time back had issues with most of them, even prosecuted some of them. What they are doing now, most of the time, they don't advertise products now. They advertise their practice, and knowing that MCA doesn't have mandate over practice. So that's the direction they go, and but on the Ministry of Health too, the unit, somehow they don't have the legal powers or whatever to be able to really regulate them, but I think they are trying to look at the laws, so all this will come into play where there will be clear-cut provisions to be able to control this practice. But the Ministry of Health is working hard on that, and already they've got an established unit to control the practice.
Thank you so much. My name is Tabora Buja, Standard Newspaper. The Director of Evaluation and Registration, she mentioned the process that you take in evaluating products. And you said manufacturers would send you a list that you will go through review before you approve. So I want to know, in that process of evaluation, how do you evaluate? Do you just evaluate it on the document, or do you have a lab? Do you have the scientific equipment that enable you to get these medicines to fight before you evaluate them? So the second question is, you mentioned that you have investigators that goes to countries to inspect manufacturing sites. So I want to ask, just for this year, from January to date, how many countries have you gone to? And have you ever went to a country where you inspect a manufacturing site and you don't find them to have meet all your conditions and you deem them not fit to import to the Gambia? And also, you mentioned that there are a list of stringent countries, countries that have stringent regulations on their medicines. Do you go to these countries, or countries that are not in this list are those that you visit?
Okay, I think I can stand for her. In terms of registration, you have to understand that MC, we are not operating in vacuum. The processes you undertake to register products, these are international processes. So we all follow the same processes. That's why in WAHU we have joint reviews, because all the processes in the region are harmonized. And also at continental level, we try to harmonize all these functions, the processes, including registration. That's why they are establishing the African Medicines Agency to make sure all processes are harmonized. Internationally, it's the same requirements. So we just follow the international standards for review that are built. There are a lot of guidelines by WHO that we go by when it comes to that one. And in terms of GMP inspection, yes. Last year, we tried to build our capacity. So we got a consultant from WHO who was here for 4 months to assist MCA to build our capacity when it comes to GMP inspection. And some of the team members also were able to get some trainings outside the country. Also, we participated in joint GMP inspections with other regulatory authorities like Ghana, NAFDAC, that have reached WHO maturity level 3. Just to say, in the whole Africa, there are 6 countries out of 55 that has reached that status. WHO maturity level 3 means the agency is functional at an optimal level as required by all standards. So it's only 6 out of 55 countries that have attained that so far. I could not recall your third question. What was it?
No, I wanted to know, like the countries that you inspect, and during your inspection, have you come up with anything that you found a factory unfit in products?
Yeah. You know, inspections, they are, again, MCA does not have its own procedure. These are international standards, procedures that we follow. So if you find a manufacturing company lacking in certain, there are certain critical findings. If you get those ones, you just disapprove the company.
The question is, have you disapproved any company?
Yes, I'm coming on. So far, we have just started. The ones we have found, we've not yet disapproved anyone. But first step is you provide your findings to them. After the GMP inspection, you send your findings, inspection reports to them. So they have to fill in a CAPA, that is corrective action and preventive action. We have a CAPA templates, you send to them all the findings. They have to do the root cause analysis of that problem. So what are the corrections and corrective measures they want to put in place? Then you review the CAPA. If you are not satisfied, you raise other questions again on the CAPA that they need to go through again. So if still you are not satisfied second time, then you reject the company. Some of them we are going through CAPAs with them, though they are not that very critical issues. And so far we've not visited many. I think in India we were able to inspect 3 companies, but there are so many companies in India, and we have only one team. We were able to inspect 3 companies in Pakistan and 3 companies in China by MCA alone. So Pakistan we did it together with WHO consultant when we went to Pakistan. That one, at least to learn from the consultant also some good practices.
Thank you very much. I think
Media organization.
I think this is a very important function, and we should be able to ask 5 questions. We have about 15 media houses. I want to ask you, Dr. Marina, since you said drugs can be degraded, and so we want to know what mechanism do you have right now currently to protect the people consuming it, since you only identified 2. People have feared that it will be more than that. And then you told us that you cannot cover everywhere. So we just want to know exactly. Another question is, other than the Chinese system, that the Chinese company where you do the testing, you told us that companies have to test there and come here and get approval. Others that come here without approval will have to send. Do you have that rating? Do you have any other means of testing? And how far will the lab?
Okay, the last question about the testing. Yes, there are 2 means of testing. You either do the pre-shipment testing before the products are sent to your country, and the post-shipment in case of products that have not gone through that pre-shipment. So these are the 2 testings you can do. Gambia, we don't have a lab that could do these confirmatory testings. We all know the lab is under construction. But this lab is not lab for MCA. This is Minister of Health. By law is another institution. So I think the updates, Minister of Health would be the right institution to give the update on the lab, because it's not under us. We also pass there as you pass there. So if we are lucky, if there is a function, we are invited there. So I think they are the right body to give update on the lab. Your first question was regarding
Protection for the consumer.
Okay. Yes, so as you know, food, just like any other product that could go bad, these manufacturers have established temperatures and humidity conditions under which these products must be kept, so that they could go through the entire shelf life up to the expiry date. They will remain to be what? Effective for use. The moment you cannot maintain that, there is likelihood that the products will go bad. And it's the responsibility of every practitioner to make sure that the products within your facility, public sector, private sector, when they go bad, you should remove them and report to MCA, so that if you want to destroy them also for disposal, you have to report to MCA. When I was at EFSTH as the chief pharmacist by then there was no MCA. Yeah, we used to have products that go bad. But we make sure that constantly we check the stores when we have such things, we document and send the products back to the central medical stores. They gather them and later on they do the disposal exercise. So these things can happen. You need to maintain the temperature, you need to maintain the humidity, which we all know is a challenge for most of the businesses at the moment.
My name is Edward Francis Dalia from Ascam Media. Yeah, I want to know if MCA is aware of the operation of a company named Total Success World. Total Success World. They are employing Gambians, and these Gambians are going in houses, selling medicine, and perceiving themselves as medical professionals. So I want to know if MCA is aware of this.
The Director of Operations, are we aware?
Dr. Yal.
Of product. Just quickly, the MCA, as Marina clearly stated, the lab is ongoing, but MCA is having a mini lab, which is doing first level and second level testing to screen the product to know, to give you an idea whether the product is genuine or substandard. If the product is substandard, then we send it to a fully fledged lab for confirmatory by using the compendia. As we speak now, we collected samples of medicine that are brought into the country by Global Fund that we are screening. And so far, that mini lab have 100% accuracy. All the products that fail the screening in our mini lab, wherever we send it, they fail. Just to make that one clear first. And to add on to the degradation that you talk about, two things involved in the degradation of product. Either the product-related factors or environmental-related factors. Marina already hammered on the environmental-related factor. We bring on the humidity, light, temperature, moisture. Some products are stable, but the moment you expose them to direct sunlight, they will hydrolyze. Some of them, the cyst forms are the potent one. For example, diethyl stable syndrome, which is used for prostate cancer. The cyst form is the potent one, but the moment you expose it to direct sunlight, it will hydrolyze. That cyst form will be converted to what? Transform, which is about 1/7 the potency of the cyst form, which is about 14-point-something%. And if the product is manufactured as per the British Pharmacopoeia, the acceptable criteria limit ranges from 95 to 105. So the moment it is 14, of course, the product has failed. So for the degradation, yes, that's why I told you earlier on, if Medicine Control Agency want to go fast, we will work alone. But if we really want to achieve the mission and the vision by safeguarding the general public, we need to collaborate with partners. And for MCA, everyone is our partner. That's why we have this toll-free number. If anyone come across anyone selling medicines, as we all know, medicine is not any ordinary commercial good that people can sell. Accelerated studies have been done. Long-term stability data also have been done to ensure that the product is stable. For the product related,
Answer the question quickly.
Can we just answer the question?
The Total Success World. That one they haven't come to my desk yet, but there are other people that we already apprehended and we already opened a case file for prosecution. So we'll be glad if you could kindly blow the whistle, contact the agency, tell us where they are, and if they come, kindly contact us. We have our inspectors everywhere. Thank you.
We have a labeling requirement. The law prescribes what features are supposed to be on a medicine, and we have got a guideline, all the features that's supposed to be on a medicine. In addition to that, you can add any feature you wish. So companies may put their logos. That is not compulsory by us, but the name and address of the manufacturer have to be on the product. So but basically most important in the name of the product have to be there, the manufacturer's name and address, the badge number is very important because one badge may have issue, but the other badges may be okay. So the product must have badge numbers. That's very key. In terms of recall, you depend on the badge number, the expiry date, the manufacturing date, and the name of the product, together with the manufacturer. So the other one, Joyce, spoke about cosmetics. Yes, this is our mandate. We try to make sure we expand on all our mandates, but it's a challenge in terms of human resources. So we employ a risk-based approach. We look at which products are the most risky products based on the competence we have, based on the staff strength we have. So medicines is no-go area. All medicines are strictly controlled. We have started, you've seen the press releases even before that one, warning people importing cosmetic products should come and regularize, should register their products. And we have started seeing people coming to register. And some of the products, before they come into the country, we have started testing some. Cosmetics coming from India, China, Pakistan, Ghana, all these products are being tested before they come into the country. So, but we know there are others from Europe and others that are not tested, and there are many other people who have not regularized. But the message to the general public is they should come and regularize before MCA will get to their shops or to their businesses. And for us, when we get to your shop or business, there are only two ways: either prosecution or administrative fine if you are a first-time offender, or depending on the gravity of the contravention of the law. So we can either go to court or give you admin fine. These admin fines have been prescribed, gazetted. People can have access to them. So MCA, we don't compromise. Those are the only two ways. We don't believe in forgiving anyone. The moment you break the law, those are the only two options for you. Thank you.
So how about the glove soap? Is it in circulation? What are the investigations?
No, so far, that particular batch, we have not come across any. Our inspectors are actively going to supermarkets, other shops. We have seen other badges, but this one, no. Because this badge, in fact, was mainly imported to Nigeria. So, but we know people go to Nigeria, people bring goods from everywhere. So that's why the alert went out, and we are also looking for it. But so far, we've not come across any badge so far.
An elaborate mandate, and then I was thinking that you need an army of staff, inspectors, technicians in the field, because you touch on every aspect of our civilization as a nation. Thank you so much, and you said an important example that people should go and register now. They know ignorance and juris non excusat, as we are told in Latin. Ignorance of the law is no excuse. Now people are aware that they need to register to be able to trade in the medicinal field. Thank you so much. And